In this video, we learn about Prader-Willi syndrome. It is a case of genomic imprinting disorder. Normally, we know two genes are received for a baby, one from mother side, one from the father side. Normally, in case of maternal imprinting, the one which we receive from the maternal side is normally silenced. Only one allele is active. That is the one which we have received from the father. That gene will be active and that will be coding for a lot of normal proteins. But in case of Prader-Willi syndrome, what happens is it's a case of maternal imprinting. So the maternal gene is silenced, but the one which we receive from the father also becomes defective. Okay, this is actually a counterpart of Angelman syndrome. Here in Angelman syndrome is a case of paternal imprinting. This is a case of maternal imprinting. So the chromosome affected is again the same chromosome number 15 as happens in Angelman syndrome, but the genes are slightly different here. The gene is SBRPN, NDN, MAGL2. These are all the different genes which are affected in Prader-Willi syndrome. The clinical features varies according to the age. During infancy, the baby will have severe hypotonia. It will be a floppy baby and poor feeding, weak cry. They'll also have a delayed motor milestones. During childhood and beyond the age, what happens is the baby will present with severe hyperphagia. So the baby can develop obesity. They can be like a morbid obesity. It can lead to, and also because of growth hormone deficiency, these babies will have short stature and hypogonadism also. Because of this, there'll be like underdeveloped genitalia. There is delayed puberty. Mild to moderate or a severe intellectual disability is also noted. They can also have behavioral issues, like they'll be doing temper tantrums, compulsive behaviors, and stubbornness, and all can be shown by these babies. So diagnosis is similar to Angelman syndrome, that is do DNA methylation testing. Again, treatment, if you see, there is no cure for this condition. Again, symptomatic treatment. Since I told they are very short stature, you can give a growth hormone replacement to increase their height. And you know they have a tendency to eat more and become more obese. So calorie restriction should be started at the earlier age. Hormone therapy can be used for giving puberty induction. Behavioral therapy for all their like OCD like traits or temper tantrums and all, you can start them on behavioral therapy. Remember, there is no cure for this condition, same similar to Angelman syndrome. Thank you.